What is septic shock? Sepsis is a life-threatening organ dysfunction caused by a dysregulated or abnormal host response to an infection. Septic shock, on the other hand, is a complication of sepsis, and it is defined by persisting hypotension that requires vasopressors to maintain a mean arterial pressure, or MAP, of 65 millimeters of mercury or higher, and a serum lactate level greater than 2 millimoles per liter, despite adequate volume resuscitation. What type of shock state is septic shock? Septic shock is a type of distributive shock where there is a loss of vascular tone. As a result, systemic vascular resistance, or SVR, decreases due to diffuse vasodilation. What are some signs of septic shock? In the early phase of septic shock, also known as warm shock, the patient may be tachycardic with a bounding pulse. Patient may also be tachypneic and have hypotension that is responsive to vasopressors. The patient's skin may be warm and flushed. The patient may display altered mental status in the form of confusion, and urine output may be low. Therefore, the patient may be oliguric. The patient may have a fever and a lactate level that is greater than 2. In the later phases of septic shock, also known as cold shock, the patient is still tachycardic, but this time the pulse is weak and thready. Patient may also be breathing rapidly or slowly, which means patient may be tachypneic or bradypneic. Patient is still hypotensive, but this time the hypotension may be unresponsive to vasopressors. And instead of the patient's skin being warm and flushed, this time it is cold and pale. The patient is also still in a state of altered mental status, but this time it has progressed from confusion to lethargy or a coma. The patient also at this time is anuric, meaning making no urine at all, whereas in the earlier phase the patient was making a little bit of urine. Patient's temperature may now be low and patient's lactate is 4 or more. Alterations, meaning hemodynamic alterations in septic shock, include a cardiac output or cardiac index that is high in the early phase, a right atrial pressure or pulmonary artery occlusive pressure that is low in the early phase. Also, systemic vascular resistance is low in the early phase. The SVO2, mixed venous oxygen saturation, is high. Oxygen delivery is high, however, oxygen consumption is low. In the later part of septic shock, the progressive stage or late state of septic shock, cardiac output or cardiac index is low. Right atrial pressure and pulmonary artery occlusive pressure is high. In one book I read, systemic vascular resistance is variable, but in another book I read, systemic vascular resistance is low. SVO2, the mixed venous oxygen saturation, in the later phase of septic shock is variable. It could be high or it could be low. Oxygen delivery is low and oxygen consumption is low. So, to recognize septic shock on your CCRN exam, look for a high heart rate, a low blood pressure, and low systemic vascular resistance. Thank you for watching, and I hope this helps.